right, good morning. I am Holly Morehouse, Vice President for Grants and Community Impact here at the Foundation. It's my pleasure to welcome you to our virtual event on mental health hosted by the Vermont Community Foundation's Insight Hub. Before I hand it over to our moderator, Martha Trombley-Oakes, I want to thank everyone for attending and emphasize the importance of this issue to the vitality of our state, our communities, our economy, and everything in between. As Vermont continues to be challenged by mental health conditions that have been uncovered by, brought on by, and deepened by the pandemic, I look forward to hearing from our panel today for what they'll share not only about how we can do more to support mental health in our communities, but also how we can do that work differently. We are grateful to our generous donors and fund holders who continue to prioritize giving towards this immense challenge, and we look forward to continuing our work to support Vermonters. Thanks again for being here and enjoy the webinar. Martha.
Great, thanks, Holly. Hello and welcome everyone to our webinar on promising solutions to improve mental health in Vermont. Today's event is hosted by the Vermont Community Foundation's Insight Hub, an information series that provides you with ideas to inform giving. I'm Martha Trombley-Oakes, and I will be your moderator today, and I'm the Director of Philanthropy at the Vermont Community Foundation. We bring this topic forward today because we know that a healthy Vermont is a state where people have the tools and support to thrive, including when it comes to managing their mental health and preventing crisis. Unfortunately, too many Vermonters struggle to access mental health care, both before and during crisis. The COVID-19 pandemic only exacerbated this challenge. Provider shortages, overtapped community care facilities, and patients marooned in hospital ERs due to lack of acute care beds are signs of systemic problems. But Vermonters are pulling together to face this problem. Today, we will spotlight a few hopeful strategies and give leaders in the mental health care and advocacy world an opportunity to share their expertise and offer ideas on how charitable individuals can help. The Vermont Community Foundation, with support from its donors, recognized the need to focus more deeply on the issue when the pandemic hit. We continue to prioritize giving in this area and hope to build more momentum for solutions with partners in government, the nonprofit sector, and philanthropy. It is now my pleasure to welcome our panelists. Vermont Department of Mental Health Commissioner Emily Hawes, who has extensive experience in both state government and community mental health leadership. Lorna Mattern, Executive Director of the United Counseling Service, the designated community mental health agency for Bennington County, whose programs include the Psychiatric Urgent Care for Kids, otherwise known as PUC, and Laurie Emerson, who is the Executive Director for the National Alliance on Mental Health, also known as NAMI Vermont, a statewide nonprofit that provides support, education, and advocacy for families and individuals. Thank you all for being here. Before we get started, let me go over just a few housekeeping rules that we have, just a few details. We have enabled the live chat feature, and you should have the ability to turn it on in the lower menu if you'd like to see it. There will be opportunities for attendees to ask questions. We will have a 15-minute Q&A at the end of our session, and so you can put your questions in the chat feature. In the Q&A feature, excuse me. The chat feature will actually be turned off so that we can streamline all comments. Additionally, if you think of questions after this webinar, please feel free to reach out to us. There's an email, it's quite simple, it's info@vermontcf.org. And of course, the webinar is being recorded and we will be posting it on the Vermont Community Foundation's website, which is simply vermontcf.org, about a week after today's event. We also want to let our audience know that we are posting mental health resources in the chat that could be helpful for anyone following along. I will ask each panelist a question, beginning with Commissioner Hawes. And after each response, there will be time for additional thoughts from the other panelists. So let's get started. Commissioner Hawes, many of Vermont's challenges to provide good mental health care seem related to capacity. Shortage of beds when people are in crisis, shortage of mental health workers to care for people in crisis, and sometimes a lack of options when people get through crisis, but still need support after. Commissioner Hawes, recognizing the complexity of these needs, what progress gives you hope? And where do you see philanthropy plugging in?
Great, thanks, Martha. So I'll start with that. We do have hope that we're making progress because that's what helps all of us show up every day. And so you mentioned some pretty big things that we're working to try to stabilize and create resources so that there's not a shortage of what folks need, when and where they need it. And that's a philosophy that DMH has been working under for quite a while, and working with our partners to help create resources so that when an individual needs support, and whatever that looks like, we want to build a system so that it's available to them when they need it. So some great progress I think that we have made recently. I think the 988 lines for folks, the national line for folks to be able to call and have that be answered by someone in Vermont 24/7. I think that recent resource has been really well utilized by Vermonters. And so that's something that certainly gives us some hope that if there are resources available, that people are going to use them. Other points of progress, and I'll say that this relates to a comment that was made in the introduction, is that yes, people have been struggling since COVID-19 happened, but also people are really resilient. And I think the conversation that we all have mental health and we are all sort of in this and helping each other and our communities thrive and has been a benefit. I think it's no longer for folks to be like, that's somebody over there who's experiencing those struggles. We're all experiencing some tough stuff. So I call that progress. I think you having us here to talk about this today is called progress. You know, some of the work that Lorna is going to talk about that UCS is taking on in the Bennington area is also initiatives that the department is interested in incorporating into other communities. We also are looking to start some mobile crisis response where people are being met 24/7 in their homes or wherever they identify as needing that support. And so those are some of the local things that we have going, but there's also some federal shifts that are really important to making all of that work. And you know, being able to conceptualize services to be co-occurring, so supporting folks who are experiencing symptoms of mental illness and also substance use. And then also incorporating those with lived experience into the service provision that our system is delivering is really important as we try to you know, help ourselves and our communities feel better.
Yeah, that's great. Thank you so much for that, Commissioner. Laurie,
Yeah.
Do you have anything you want to add to what the Commissioner has said?
I really like that you touched upon the 988 number, Emily, because, you know, that was a big initiative here in Vermont where, you know, now, because this is a crisis number, people can call this number 24/7 whenever they need help instead of calling 911. So, you know, we're really trying to promote this for the community, for families, individuals. If you need someone to talk to, that's the first step.
Laurie, oh, sorry, Lorna, just real quick. I think being somebody who's been in the field, I think there was an assumption that people knew like the crisis number of the local designated agency. And that was obviously a false belief. And so incorporating a 988 just makes it much more seamless and, stick in your brain kind of a way where you're able to recall that when you are having a tough time. So sorry to interrupt you, Lorna.
No, you were took the thought out of my head that 988 is a really nice connection with the local designated agency. So folks can easily remember 988. They can get in touch with the local agency who then can provide mobile crisis outreach to wherever that person is calling from. And that varies from agency to agency, but to talk about specifically UCS, we have a mobile crisis unit that is really quite robust and gets out there in the community often and works, building our relationship with 988 is something that is really important to us as well.
Wonderful.
Ensuring that funding too for that support of 988 is so important because it seems that right now it's year to year and having that funding. I know at the federal level, they were looking at creating legislation to maybe have a fee on phone lines of, whether it be just 10 cents a month. I know Vermont's not doing that right now because we do have the funding to support that, but it needs to be ongoing. As well as developing the other systems we need to support 988. So if the phone call doesn't work, then what do you do? The mobile crisis teams are the next step. So someone to respond.
Yeah, Laurie, I think that's really important because it takes all of those things working at a high level for our healthcare system to be healthy. And we see that from those services who are delivering, mental health supports and also physical health supports. If you don't have a healthy healthcare system, then your first call doesn't necessarily prevent you from going to the highest level. And so I think that's what we're all trying to do is to, support folks and not needing to go to that high level of care unless they really need it. But there's a lot of stops in between when you're first starting to experience any challenges.
Yeah, and I just wanted to remind our audience members that the chat feature has been turned off, but we encourage you to submit your questions through the Q&A feature. So if questions are coming up, please submit them through the Q&A feature, which we will get to towards the last part of our time together. My next question is for Lorna. Lorna, we know it's important to keep kids and teens with mental health needs out of the ER whenever possible, and that programs like PUC in Bennington are doing just that. Lorna, can you share with us how PUC came into existence and what you've learned from this model of care?
Sure, I'm always happy to talk about PUC. We're very excited about this program. So PUC, as Martha mentioned, is the psychiatric urgent care for kids. And the concept began at around 2018 when members of the UCS leadership and Southern Vermont Medical Center got connected because we were really concerned about the increase in the number of adults and children who are presenting in the emergency department as a result of a mental health crisis. And we decided to concentrate on children and youth, in part, of course, because they're vulnerable folks. We also know that kids were getting removed from school because of behavioral health issues, because they were disruptive in the classroom. And oftentimes they were removed from school by law enforcement. So we were very concerned about the fact that kids were getting removed by law enforcement from their classroom, being transported from the school to the emergency department. Between the assessment of the emergency department and the evaluation and the stay itself at the ED is really rather traumatizing. Once they're in the emergency department, regardless of their mental health issues, they have to be medically cleared. And any of you who've ever been in the emergency department know that it's a really arduous and difficult process to go through. So now imagine being there, going through that process, but also being in a mental health crisis. So it just doesn't make sense. And we know that it doesn't make sense for folks to be there, but we also know that there wasn't any other option. So One Care, which is our accountable care organization in Vermont, had an innovation grant that was put out around 2018. And so we thought that this was the perfect opportunity to get some funding and create this mysterious model that we weren't quite sure what it was going to look like. But through our process of creating and writing this grant, we identified that there are about 200 kids in the year of 2018 that went to the emergency department for a mental health assessment. And 80% of those kids went home without a treatment plan, which means that 20% of the kids that went there needed to go to a stabilization bed or needed to go to a psychiatric hospital, but 80% didn't need to go there in the first place. But again, what's the alternative? And so that's kind of where PUC came from. So now, what is PUC? I think it's important to kind of let people know what that is. And essentially, PUC is a child-friendly, trauma-informed crisis stabilization program that provides therapeutic and calming location for children and their families. So the PUC space is at our Youth and Family Services office. And it's a large space that kids can move and explore in, but also there are some private areas for kids that need a nap, for kids who need to be able to meet with a clinician or to meet with a family group. There's a sensory room where kids can go in and use sensory equipment that are anywhere from body socks, because kids, they need to move, because, think about when you're anxious or upset, you can feel it in your body. Same for kids, right? So they end up moving, and there's a swing in this room and a trampoline, small trampoline. And you all, everybody uses kind of sensory equipment. So this is a mood dude, and, you squeeze it, we've all had those squeeze things and various other things that you can use that help you kind of, there it is. See, Emily's got one too. And so that's the kind of tools that kids can find useful. And during the time that they're in PUC, they can have access to psychiatric consultation, or the psychiatrist consult with their primary care physician. They have access to a licensed clinician, a mental health screenings for depression, anxiety, suicidal ideation. And we certainly know that since the pandemic, kids are feeling more and more anxious and more depressed. And certainly our suicidal ideation and suicide has increased. A UCS nurse can be on site to look at health, physical health assessments, one-on-one interaction with the case managers and community support. We could do school reentry programming. So if a kid gets kicked out of school, we want to be able to help them re-enter the school successfully so they can stay. And we will help them do that. Information and referral, and certainly they can have an intake to be a part of UCS if they needed long-term care. We hope that a child stays no less than 2 hours, so we can kind of give them what they need. And they could stay for up to 3 consecutive days as long as they can safely return home in the evening. We're not a 24/7 overnight program. And if you don't mind, I'd like to tell a little story, because I think it's hard to kind of conceptualize what PUC is and the impact of it. So a couple of weeks ago, there was unfortunately, there was a murder in Bennington where a person shot and killed somebody else. And a 9-year-old boy came into his elementary school the next day, and he told people that his uncle was going to come and kill everybody. Now, before PUC, I'm certain that the police would have been called. He would have ended up in the emergency department, transported by the police. He would have been suspended because he made a threat. But instead, they got in touch with us, and our crisis mobile staff went and scooped him up, brought him to PUC. And while he was there, he was able to kind of get back to baseline, be able to be calm, and be able to share with a clinician that he wasn't threatening his uncle to come to the school. He was afraid that his uncle would come to school and shoot people. He was afraid that his friends wouldn't like him anymore because of what his uncle did. And he was angry about what his uncle did. And so we have this incredibly talented young man who is an artist and a staff person. And he sat with this boy and was able to draw the boy's anger. So as the boy was talking about what his anger looked like, he created an anger tiger. And together they colored this tiger, and the boy said, "That's it. That's what I look like. That's what I feel like." And he was excited to be able to take it with him. We laminated it for him so he could take it with him and show people at school that when I'm angry, this is what I feel like and this is what I look like. And that's the impact of Puck for him and, you know, for many, many other kids that have come. So I can keep going. You talked about lessons learned. Do we have a moment to talk about that? Okay. So I think the things that we learned is that every community in Vermont needs an alternative to the emergency department. Because we know without an alternative, we'll continue to access the emergency department. And we've seen approximately 100 kids a year since we opened. So we know that it works. And we know that it works because we've also seen a decrease in ED utilization between 33 and 40% since 2018. The pandemic years are a little harder to kind of figure out, but that's our best guess. And then finally, we also know that you know, our staff is really open to jumping in and covering, but we need a dedicated group of staff that are available. Just like the emergency department has dedicated staff that are available, even if nobody's in the ED, you know that you can go there and get care. That's the same kind of thing that needs to happen for an urgent care model, is that we have to have people that are ready to jump in. And we've seen the need grow. We have a kid in Puck, 1 or 2 kids in Puck every day. And we also have turned away at least 1 child a week because of staffing and capacity issues. So I'll stop there. As you can tell, I can keep going, but I won't. It's a great program.
Thank you. It sounds like it. And I'm going to ask if Commissioner Hawes has anything she would like to add from her perspective.
I would just say that we, you know, certainly have, I don't want to say like watched UCS and the Puck program very closely, but we have, because they have made such positive impacts on the individuals, you know, who need that level of care. And we're appreciative that they were able to do that in their area, especially in the nice collaboration with Southwestern Vermont Medical Center, which is what we, you know, like to see, is a designated agency or community resource being able to team up with their local hospital in order to support their community. From a DMH lens, we just closed on a request for proposals for alternatives to emergency departments, like Lorna mentioned, so that we can look at doing some of this work in other communities. And other communities may want to do a Puck model, or there may be another model that also impacts folks positively that might work better for other communities. What's interesting about Vermont is that you need to have a lot of tools in your toolbox, because, you know, each community has different needs to support their you know, friends, families, and neighbors. So you know, DMH is really interested in growing that. We don't want folks in emergency departments either. So that's what I would add. And I know Laurie might have some comments too, so I'll turn it over to Laurie.
Thank you. I am so excited to see this best practice in action. This is exactly what we need in every community. It's, you know, that collaborative approach between the designated agency, school, and the hospital, and supporting our youth, getting them the help when they need it, because that's really reducing trauma to kids, bringing law enforcement into schools, bringing them to emergency rooms is a very traumatic experience. And we're de-escalating all of the situations that schools are experiencing. And I'm sure they really appreciate having you work with them. I hear time and time again from so many schools, so many families, how, their child is struggling. And what they need is to talk to somebody, validate their feelings, using art like you do to be able to help them. So how do we replicate this in every single community to get kids the help they need so they're not traumatized and having positive experiences with the mental health system?
Great point, Laurie. Laurie, I'm going to ask you the next question.
Mhm.
What role does wellness and resilience strategy play in reducing mental health crisis? And how can Vermont support more of this work to keep people healthy?
It's all about balance, right? It is so critical that, you're balancing your mental health, your physical health, your emotional well-being, your spirituality. And the more we can focus on prevention and maintaining our wellness, we're really going to help intervene early to help people. And like Emily had mentioned, we need to build a toolkit of wellness techniques. And some people look to using the medical model. They might look to medicinal therapy, talk therapy, and other people look at the recovery model and using those strategies. And I'll just name a few of those as I go along. But some people also need to use both. It's not one or the other, but those combinations of strategies really help people maintain their wellness. And for many people, it's really starting with the basics. Do they have housing? Some people might need supported housing to maintain their wellness, to be able to have the support system right where they live. Or just eating well, getting enough sleep helps your mental well-being, exercise, finding meaningful work or volunteer opportunities really help people maintain their wellness. And many organizations are able to help in that respect, to help people. There's a great program called WRAP. That's a wellness recovery action plan that people use to define, what are those strategies, those techniques to use to be able to help my wellness, going to that plan when they need to, and tapping into that toolkit to find what do you need, as well as people creating a psychiatric advance directive is another approach to make sure your wishes are met if you do need help, if you do need care. And there are organizations that help with developing these different tools. One of the programs that I took was intentional peer support. And I found the training to be so helpful for me. It's an alternative approach that explores ways to use mutuality and build supportive relationships. And I started using these techniques at home with my son because, as a parent, I think we always want to fix things, right? We always want to say, oh, have you tried this? Or how about doing that? But that's not the approach. And the more you can empower people to find their recovery, you're developing a better relationship with them. So this can be used in all relationships, even in your work relationships. As well as, we really need to advance in Vermont peer support specialists and the certification program. And I know that process has started. So I'm very excited to see that as it comes to fruition. But really, too, what I hear from families is it's the accessibility to care. And when our loved ones are in crisis, they want help immediately. They don't want to wait a day, a week, 2 weeks, 3 weeks in the emergency room. They want help right then and there when they're receptive to it. And having more urgent care models can help in that process. People just might need someone to talk to validate their feelings, or, help them come to a better understanding of where they're at. So we really need to work on making sure there's that continuum of care, that we don't have those big gaps in the system where people are going to the emergency room and the doctors and nurses there are not trained to support mental health. So how do we change that? How do we reimagine this crisis intervention so that people are able to get the right help at the right time? It's really exciting to see the mobile crisis teams are developing more. They're working with law enforcement, and that's another thing. We want to eliminate law enforcement in mental health crisis. We need people who are trained to be able to go there and help people immediately. And I think most importantly is a place for people to go if they need to. And it's not the emergency room. Maybe there are some people that have that acute illness and they do need that type of care. How do we intervene earlier? How do we get people the help they need when they need it? And especially having more co-occurring support for people. And I think one other thing that I did want to add, this is more looking at when people are in crisis, but with kids and the support that they have and needing inpatient care, we have very few facilities here in Vermont. Brattleboro Retreat, and I know that DMH is looking to also get another place. But how do we distribute that throughout the state? How do we make sure that people up here in Chittenden County are able to bring their child to a place that's close to home so that they can go home at night to their other kids and support them too? So, really having regional support systems throughout the state is so very important.
Laurie, we have folks on this call who may be interested in supporting ways in which can support some of these efforts. And I'm curious, from your perspective, what are some of those ways folks can help?
Well, I know another model that's been working really well is peer support respite, so that people can go and get peer support. It's not clinical, but that's what works for some people. And having more of those options, we do have one place, Alyssum, that does it, and I know their Howard Center has the ASSIST program as well, and there are other respite programs too. But we really need more of that in many different regions. I could go on and on about the different ways that people can help support, but I think it's really intervening early, supporting the nonprofits that are able to help people and meet them where they're at, to be able to let them know that they're not alone and give that support. NAMI Vermont has support groups. We have educational classes. We need more of that. When people are in crisis, they need education and training to know, what do I do? How do I respond? How do I cope? And being able to educate people and give them hope is what we need to do. There are many different programs that can help support that work.
Great. And I'm guessing that if folks go to your website, they can find some of those resources?
Absolutely. And there's many other great nonprofits that are doing really good work too. So how do we keep funding these programs? How do we keep supporting them? And it seems like for the longest time, we were just trying to find ways to fund our programs. And, now that mental health is in the forefront, a lot of organizations are coming to us. Vermont Community Foundation is coming to NAMI Vermont, wanting to help support youth with our Ending the Silence program that we have, to give them the education to be able to help teach them how to help a friend, how to cope. So we need to keep that momentum going to change the generation so that they are seeking help. We're eliminating the stigma.
Thank you so much, Laurie. Do any of the other panelists have anything they'd like to add?
I wouldn't mind just adding a couple of things. First, thank you, Laurie, for your work at NAMI. I think one thing that struck me while you were talking was it's not all rosy. We have some significant gaps in our system. So I don't want folks to think that, we're looking at it with rosy glasses, but we have to in some ways. But I acknowledge there's quite a few gaps in our system, which is why we're trying to work to solve that. And from a funding perspective, oftentimes from a federal lens, those dollars can't be spent on preventative care or prevention activities. And so I think we've started to see a little bit of a shift from that, because like Laurie said, we know that meeting folks upstream, so to speak, or before they're in a crisis is far better than waiting until the crisis is hitting. And I'll also say that, when I think about, maybe 30 years ago, when I first came into the field, people, and even before that, people equated getting help as sending somebody off, sending them to live somewhere else, sending somebody to a hospital, or just sending somebody away. And we've shifted so nicely away from that, right? That really shouldn't be our approach. And we've learned that that's not a great approach. But in the course of that, there's been gaps in the services and resources that can really support folks in their community. And so, I think we've made some really nice strides in that, in moving away from the shipping off to somewhere else lens, and thinking about what other things really support folks. It's not just that you go and you get medication. We've talked about probably 30 different things that folks need to have in their toolbox outside of those, really simplistic, I think, views that our system had, 30, 40 years ago. So I'll just add that. I want folks to, we do have gaps, and I don't want folks to think that, we're not recognizing that, but we certainly appreciate and acknowledge all the work that Laurie and her group has done. So.
And if I could jump in for a minute too, Laurie, boy, you hit on so many things that I think we could probably have a few more webinars on. But, we certainly have, I think many of us have heard that, exercise is one of the most under prescribed medication for depression. And so all of those things around wellness really does have some significant impact on our mental well-being. But you touched on the peer support. And I think when we're talking about, perhaps, Martha, you had mentioned people on the call, like what can they do? Peer support programs are those kind of programs that are not generally funded. They're not generally something that we can access Medicaid or insurance to help cover. And they are a best practice model. And, UCS just hired a couple of peer support folks because we shifted a case management position to a peer and have 4 peers that are sharing, or 3 peers that are sharing that position now. And the impact is significant. And there's a little bit of a shift of, okay, so we might not be able to have this case manager, but we have to kind of sacrifice this position to be able to bring in these peers. So that might be something that is a very specific kind of area of funding that could really make an impact in various areas to be able to hire peer supports.
Lorna, thank you. That's incredibly helpful. And also having that insight into that's not something that's generally funded, by other sources. So there's a number of questions that are coming in, and they're really good. And one of them actually gets to the peer support. How are our young people and youth getting access to peer support? So while we're on this, I just thought I would throw that out to the group.
Well, from our perspective, we have something called Teens for Change, and we have after school groups, and we have all sorts of groups all over the place. But one of the things that Teens for Change does, it's a peer-led, youth-led group that really looks at volunteerism in the community, leadership, working together to solve problems. And so that's one area within our system. There's so many other things I think that peers and communities are doing to help support peers. And I'm not sure, Laurie, if you have anything particular at NAMI.
Some schools are working with the students to empower the students to lead these groups. And, it's giving that peer-to-peer support. It's being able to have clubs within the schools. It's really empowering them in the same concepts that we're using with adults, and getting them to be able to be creative and thinking of what they want to do. And, I'm working with Alex Zener-Federhen, Miss Vermont 2022, and she's helping us to go out to the schools, talk with the schools. Her social impact is on teen mental. And she wants to travel throughout Vermont, be able to help the schools out. And that's what we need to find. Who are those role models that we can tap into? And a lot of times, even the sporting events and the athletes at school can be those role models to be able to model the behavior of them and to openly share. It's really having that open dialogue, or like we say, ending the silence. So let's keep talking about it.
Yeah, that's great. Commissioner Hawes, did you want to jump in on that? Because I have a question for you.
Yeah, well, I do want to jump in a little bit, because we talked about peer certification a little bit earlier with Laurie, and there is an initiative around peer certification, which is geared more towards adults. But as we've been talking, I've been thinking about, we do have an opportunity for, maybe a gap in looking at how, and do we want to think about exploring some sort of a peer certification for our youth that's outside of, so I'm sort of talking and planning out loud right now, which usually never ends well for me. That certainly is something I'm thinking about, that we have some opportunity for improvement on. That's really a gap when we talk about how to support our youth, at least from my lens.
Thank you. So Commissioner Hawes, recognizing the complexity of need, what progress gives you hope, and where can philanthropy plug in?
Yeah, that's a really good question. When I think about philanthropy, I think I alluded to this a little bit earlier, and that there's so many things that help us all feel better. And when you think about what's a billable service, so to speak, versus what's not a billable service, I kind of make it, that's a simplistic view. That's sort of what I look at when I'm thinking about how can philanthropy support some of those gaps. And I'll say that we're also having conversations with insurance providers and stuff like that to help them understand all the different tools in the toolbox. But when we talked earlier about exercise, yoga, also training needs, diversity and inclusion training across staff and across our healthcare system in general. I think any of those types of activities that wouldn't be summarized as your typical billable service are likely a great thing to think about when thinking about philanthropy. And that could be with designated agencies, that could be with schools, that could be with your local hospital. providing supports for the emergency department. Let's say if there is a youth or an adult who's in one of those departments, and we know they're very busy and they can be overstimulating, and so philanthropy could support sensory modulation projects. There's a lot of opportunity there for folks to be engaged in their giving in that way.
Thank you. Thank you. We have a great question that's come in from a concerned community member, wondering if the 988 is accessible to community members who may not be in crisis themselves, but are potentially worried about someone, whether or not they know them, or in this particular situation, there was a gentleman outside of this person's home, it sounds like, and is 988 the right resource for that person to call, to say, you know, we need help, versus say a 911 or the police?
I would say yes. I would say you could call 988 and talk through the situation, and you'd have somebody on the other line, to support you for experiencing someone else in distress who you might not know how to support them, and then also how to assist maybe getting that person help that they may need.
The other thing I kind of throw out too is that we have mental health first aid training for community and staff, but generally speaking, mental health first aid, and not that I'm suggesting this person go out and do this with this individual in their yard per se, but mental health first aid is very similar to CPR and first aid. You're not going to provide surgery with somebody coming upon it, but you will know how to respond in a medical crisis. Same thing for mental health first aid. It's usually pretty inexpensive to take the training, or free, depending on funding. But that's maybe also something else for community folks to look at in their community for an opportunity.
That's great. Laurie, did you have anything you wanted to add?
I think that's been covered, and calling 988, they can help point you to the resources that might be available in your community. So there may be a mobile crisis team that could go out. They would have the answers.
Great. That's great. So one more question. We know some capacity problems related to unfilled jobs in the mental health sector. What's the latest on addressing workforce challenges?
Wow, that's a big question.
Does anybody have the solution for that? I think this last legislative session, there's been some really nice opportunities around loan repayment, retention, recruitment dollars, which I think has helped somewhat in the recruitment strategies. I think some of the shortages are complex. We did have, like, from a nursing lens, we were on the verge of a nursing cliff to hit us in 2026 due to retirees. And that cliff happened a lot earlier due to COVID. And so part of, our staffing shortages are age. Some people have left the field altogether. Some people, the field isn't attractive because pay isn't necessarily equitable with other professions. And so we have a lot of work to do to solve that work shortage that was really exploited during COVID. And how it will challenge us to really rethink how we do recruitment, education, retention. All of the things that worked pre-pandemic likely don't work anymore in keeping someone engaged with a job.
Yeah. And, just also talking about with the pandemic, remember we had people who were treating people while living through a pandemic themselves. So we certainly are feeling the burnout of that. I think people who were going to not retire quite yet retired as well. So that came faster. We the mental health system and substance use system has just been chronically underfunded for years, to no fault of Emily's or the Department of Mental Health, as it is a culture that mental health, you can't have mental health without physical health, and physical health without mental health. It's a whole body, it's connected, right? So we have always valued physical health far beyond valuing mental health. And the pandemic has a silver lining, I guess, for the pandemic is that it has really put mental health at the forefront. And so I think that we're working in the right direction, and we're so far behind that even though we received an 8% increase in our funding, we're still probably about 20% behind where we should be to be able to pay people how they need to get paid. And fewer people are coming into this profession anyway. In part, it's you go to college, it's incredibly expensive, and then you come out and you get paid $17 an hour, and you have loans, and you don't have that work-life balance that we're talking about with Laurie around wellness. So there's so many reasons not to come into this profession, other than, of course, the passion for helping people, which is pretty amazing. But I think certainly younger folks want to be able to live and work without the significant stress and without having two jobs to be able to make balance.
Yeah, I think you're absolutely right. Parity is so important that it does seem that physical health is valued more than our own mental well-being.
Mhm.
And people should be paid equally, whether it be physical health. So, there are some changes that need to happen. I think Vermont is really good with providing mental health care. Insurance covers it. There are some difficulties, I think, with Medicare in people being able to get the help that they need through the providers. But there are some system problems, but it's really great knowing that here in Vermont, it's a very caring state, and we're doing everything we possibly can to help.
That's wonderful. Well, as we begin to look at wrapping up this conversation, which has been incredibly rich, I just want to give each of you an opportunity just to say one last thing that might be on your mind that you would like audience members to think about as they are contemplating their own philanthropy, their own volunteerism, just maybe a hopeful tip that you can provide.
I just want to mention that recovery is possible, and there is hope for people, no matter where they are in their journey. That it takes a lot of hard work for people to maintain their wellness, and I'm just amazed at the resilience of people to be able to keep going and maintaining their wellness, and then giving back to other people, and being able to tap into that peer support and helping people to find meaning and purpose is what we really need to do.
Mhm.
Thank you, Laurie.
Yeah, Laurie, that's absolutely right. First of all, I do want to thank the Community Foundation, because UCS and PUC received funding and support. So thank you to anybody out there who is part of that. It's really meaningful, as you can remember if you think about the 9-year-old boy I talked with you about. And then I think the other thing that I would say is, as folks who are looking at where you want to invest your dollars in your community, any time that we can be helpful in helping you understand kind of what we do, because it's really hard to help people understand kind of what we do. Like, I don't think my parents ever knew what I did for a living, because it's just such this out there kind of thing. What does it mean, and how meaningful is it? And it's hard to put your finger on it. So any way that we can help you understand, a time that you want to ask questions. I invite anyone to get in touch. Let's have coffee. Let's talk about it, and more specifically, if you want to in any way to be helpful. And I agree with Laurie. There's a lot of hope. It's amazing what people can live through, thrive through, and the resiliency. So I appreciate that people took the time to be a part of this, that we're all very obviously passionate about.
Lorna, I really appreciate that comment, and I find it incredibly interesting that this is a topic in which people have a hard time understanding,
Yeah,
and yet it impacts
everyone.
everybody. And so, we're bringing awareness to it.
Yeah, thank you.
Yeah, thank you.
I'd just add that it made me think about, I just went and visited my family back in October, and my dad has no idea what I do, and just calls me a talker, that I just talk. I just talk to people, and that's his definition of what I do and what I've always done. So it's such an interesting, you break your arm, you put a cast on it, and you're good to go. And this is just a very different approach and conversation about how to support folks. So I appreciate you saying that, Lorna. And I think, Laurie's comment about community connection is so important, right? We all want to feel connected to our communities and to other humans, and how important that is when we're thinking about our individual wellness. And so that's all I would add with. I think they both articulated that really well, and very thankful for the Community Foundation for having us here today to talk about this. And DMH is also open if folks want to connect with us to learn about the things that we do when thinking about giving. We're happy to talk through. We certainly have a different role for the system than Lorna and Laurie do, and that may be where someone wants to focus on as well. So.
That's great. Thank you for throwing that out there, Commissioner. And with that, we are out of time for today. And I just want to thank you all for this great conversation. Special thanks to Commissioner Hawes, Laurie Emerson, and Lorna Matern. All attendees will receive a recording after this about a week from today. So please stay tuned. And there are other briefs and articles and videos from former Insight hubs on the Vermont Community Foundation Insight page. So please take a look at that. And you will also receive a survey. So please just take a moment to fill out that survey. We really look at that feedback and take it to heart and make changes and plans for future events. So thank you, everyone. Thank you for being here, and have a really great day.
Thank you. You too. It's been wonderful.
Thank you.